In the last video, we described Hashimoto thyroiditis and talked about the role of selenium in the disease according to a review study published in 2017. So, if you haven't watched it yet, we encourage you to take a look at that and then come back to this video. The main idea of this study is to draw attention to the role of diet for the management of this disease by compiling the literature research on the importance of iodine, selenium, vitamin D, and gluten. For simplicity purposes, in this video, we'll focus on the role of vitamin D, but again, we encourage you to watch the videos on the role of the other factors. Although it's called vitamin D, it's actually a steroid hormone produced by our body and that plays a central role in the regulation of calcium phosphate homeostasis and bone intensity. It is synthesized within the body via two routes: skin exposure to sunlight and dietary intake. The most biologically active form of vitamin D is vitamin D3, or cholecalciferol, and it plays a crucial role in regulating the immune system. Several studies have shown the correlation between vitamin D deficiency and thyroid autoimmunity. Furthermore, it is shown that vitamin D3 supplements are effective in reducing antibodies in the thyroid of patients with Hashimoto's and vitamin D deficiency. However, it's still unclear whether the low vitamin D levels observed in Hashimoto's patients are the result of the disease itself or actually part of its cause. The Endocrine Society of USA guidelines affirmed that daily vitamin D intakes of 1,500 to 2,000 international units are needed to raise the blood level of vitamin D above the minimum, whilst the Institute of Medicine of USA reported that the tolerable upper intake level, defined as the maximum daily intake, above which the potential for adverse health effects may increase after chronic use, is 4,000 international units per day. This review concludes that with an optimal dosage of approximately 2,000 international units of cholecalciferol per day, regardless of increased exposure to sunlight, you can achieve a sufficient level of vitamin D that is adequate for avoiding metabolic and autoimmune disorders in more than 97% of the population. Nevertheless, the main side effect of vitamin D overtreatment is hypercalcemia and nephrolithiasis. To avoid coronary artery calcification, which is an important predictor of cardiovascular disease, concomitant use of cholecalciferol with vitamin K2 may be necessary. Before we conclude, please don't forget to subscribe to our channel if you're curious about science applied to health issues, and hit that bell icon so you receive the notifications every time we upload a new video. In summary, the presented data demonstrate the association of vitamin D deficiency with Hashimoto's pathogenesis, thyroid hypofunction, and autoimmunity in general. Taking into consideration the low cost and the minimal side effects of vitamin D supplementation, screening for vitamin D deficiency and careful vitamin D supplementation with monthly monitoring calcium levels, when required, may be recommended for patients with Hashimoto's thyroiditis.
Please note this video is our interpretation of scientific papers. It is merely informative and doesn't constitute any form of advice. If you have any health issues or concerns, please contact your physician or licensed health professional.